Hello, Mercy here. I am a doctor of nursing practice. Welcome back. Part two of drug abuse this week. I want us to focus more on why do people get addicted and what community services that can be out there for them. Again, keep the topics coming, keep the calls coming, 682-376-6776, or email us at mercy@allmercypic.com. From part one about drug abuse, the questions that we got mostly was when should we start talking about drug abuse and where should we start talking about drug abuse? I think age appropriate family discussions start at home, right? Family discussions with your children about certain things that is happening in the community. Remember, if you don't teach them or if you don't talk to them, they'll go out there and they'll hear it anyway. And they may be hearing the inappropriate or the incorrect information. So please start it at home during family discussions. You can also, I see it being implemented in school at this time. So you can also sign that waiver. They always send waivers. Do you want us to educate your child about drug abuse, about sex, things like that? Also, remember to sign those waivers. Then when the child come home, ask them what is it that was taught about so that you guys can talk about it. Early education prevention programs in the community during festivities, when you have community meetings and events like that, those can be introduced. Therapists normally go there and they always find activities to do or teaching topics to do. You can start talking about drug abuse and things like that. Even media presence. I believe that there are many opportunities in the media where people can learn also about drug abuse. In healthcare settings, we teach people a lot, especially drug abusers. We teach them a lot about how to identify the symptoms and identify when it's becoming a problem. I believe we should not just be teaching the patients, we should also be teaching ourselves, the employee. Let's talk about it. Let's have wellness campaigns or wellness forums where we are teaching everyone, employees included, about drug abuse as well. Uh, Adolescents, early elementary, classrooms, community services, employee wellness programs, everywhere. Drug abuse should be a continuum. It should be evolving. It should be a day-to-day issue as everyone, if one household is affected or impacted, that leads to the community, that leads to the society, that leads to a nation as a whole. Everyone is affected. So it is a call for action. Again, drug abuse is a complex and serious public health issue that involves the excessive and harmful consumption of substances, both legal and illegal, with detrimental effects on our overall well-being. Some key points to consider when talking about drug abuse are: drug abuse refers to the misuse of substances that can alter the normal functioning of the body and the mind. These substances can be broadly categorized into legal drugs like alcohol, tobacco, and prescription medications, and illegal drugs such as cocaine, heroin, meth, and cannabis. Several factors can contribute to drug abuse, including but not limited to genetic predispositions, environmental influences, peer pressure, trauma, mental health disorders, socioeconomic status, and availability of drugs. With genetics, we see a person's susceptibility to addiction. However, environmental factors often play a significant role in whether abuse develops or not. Drug abuse can have severe health consequences affecting various aspects of our well-being. These can include physical health issues like liver damage, respiratory problems, heart disease, mental health disorders like anxiety, depression, psychosis, impaired cognitive function, weakened immune system, and an increase of accidents and injuries. Drug abuse can lead to addiction, which is a chronic and relapsing condition characterized by a compulsive need to use a substance despite negative consequences. Physical dependence can also develop, leading to withdrawal symptoms when the drug is not consumed. We often focus prevention on the efforts of campaigns, education, and promoting healthy coping strategies among abusers. Treatment for drug abuse and addiction can involve behavioral therapies, counseling, medication-assisted treatment, support groups, and inpatient or outpatient rehabilitation programs. A comprehensive approach addressing physical, mental, and social factors is typically most effective. We use harm reduction strategies to minimize the negative consequences of drug abuse without necessarily requiring abstinence. These can include programs like needle exchange programs to prevent the spread of infectious diseases among intravenous drug users. If used when not allowed, you can have legal and social implications leading to criminal charges and incarceration. It can also strain relationships, disrupt families, and impact job stability and financial security. Drug abuse remains a global concern, with different regions facing varying changes related to specific substances and cultural contexts. International efforts often involve cooperation between governments, law enforcement, healthcare systems, and non-governmental organizations to combat drug trafficking and provide support for affected individuals. Continued research and education into the causes, effects, and treatment of drug abuse continues to evolve. Public education and awareness campaigns play a crucial role in addressing the stigma associated with addiction and promoting early intervention. It's important to approach discussions about drug abuse with empathy, understanding, and a focus on evidence-based information. If you know someone dealing with drug abuse, please help them seek professional help always. We do recognize the fact that this may be a very sensitive issue and also surrounded by a lot of conceptions or misconceptions about it, making it difficult for drug abusers to seek help, even if it is a loved one. It becomes so difficult for them to open up and say, hey, I'm struggling with this, or I need to talk to you about this. So sometimes it may be your child, it may be your loved one, it may be someone, an acquaintance, a neighbor, somebody that you need to help. So it is also very important that we talk about some common symptoms or signs that you can tell that maybe something is wrong with this person. Maybe this person has started using some substances. So it is good to learn of some common ways which can help you identify. Remember, when you identify it, once you find a problem, then you're already so certain most of the time to find a solution. Identifying drug abusers can be challenging as it often requires careful observation and consideration of various signs and behaviors. It's important to approach this matter with sensitivity and without making assumptions. Here are some potential signs that could indicate drug abuse. Physical signs: bloodshot eyes or pupils that are extremely large or extremely small. Frequent nosebleeds for drugs that are snorted. Rapid weight loss or gain. Tremors or shaky hands. Changes in personal hygiene and grooming habits. Slurred speech or impaired coordination. Behavioral signs: sudden and drastic changes in behavior, mood, or attitude. Neglecting responsibilities and obligations at school, work, or home. Withdrawal from friends, family, and social activities. Loss of interest in hobbies or activities they used to enjoy. Increased secrecy about their activities. Psychological signs: sudden mood swings or extreme moodiness. Irritability, agitation, or aggressive behavior. Anxiety, paranoia, or feelings of being overly energetic. Decreased motivation and lack of interest in the future. Difficulty concentrating or making decisions. Social signs: associating with new, potentially risky friends. Engaging in risky or illegal activities. Isolation from family and friends. Drastic changes in social circles or friend groups. Physical evidence: finding drug paraphernalia such as pipes, needles, blunt spoons, or small baggies, discovering substances that look like drugs such as pills or powders in their belongings, changes in appearance, poor personal hygiene, neglecting physical appearance and grooming, rapid and unexplained weight loss or gain. It's important to note that some of these signs may be also indicative of other issues such as mental health conditions. If you suspect someone is abusing drugs, approach the situation with empathy and care. Consider having an open, non-confrontational conversation with the person, expressing your concern and willingness to help. If the situation is severe or dangerous, it might be necessary to involve a professional, such as a counselor, therapist, healthcare provider, who can offer appropriate guidance and support. I hope we all relearned something, or we all reminded ourselves about some information, some pertinent information about drug abuse. Let's stay tuned for our E word. The words are already coming in. I'm excited. I am so excited. And thank you for those who are already sending us the words. Let's stay tuned for our E words in our A to Z series next week. E word, we'll disclose that next week. Thank you so much, and bye bye for now.